So, doctors, let's jump into iron deficiency anemia right away. Now, as we do, we're going to try some questions. So, who wants to take the first question for us, please? Who wants to take the first question?
Doctor, I
So,
can try.
okay, please, doctor, go for it. Let's go. Go for it. Go for it. Go for it.
A 62-year-old male is found to have a ferritin level of 12 nanogram per milliliter during routine screening. He denies any overt blood loss. Which of the following would be the next most appropriate step in his management? Option
Good.
A, start oral iron supplementation. B, test
Mhm.
for Helicobacter pylori. C, order a colonoscopy. D, recheck ferritin level in 6 months.
Okay, beautiful. So let me see the answers coming. Zoom team. So I see C, 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 C. Oh, somebody wrote something interesting. Somebody wrote age is key. Somebody just wrote age is key. So Facebook team. Okay, Dr. Asia also says C. So it looks like for this particular concept, I've driven it deep, 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 deep. So the answer is C, colonoscopy. It is correct because older patients with iron deficiency anemia
Mhm.
and no obvious cause of the anemia, you want to evaluate them for occult GI bleeding. That is
Yes.
standard of care, right?
Mhm.
I know back home, and the way we're trained, some people will request for, oh, let's do iron studies first. No, 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 no. Standard. Iron deficiency anemia, patient above 50 years, the patient has not been in any trauma, the patient does not have any bleeding disorder, just boom, iron deficiency anemia, go for colonoscopy. Go for
Mhm.
colonoscopy. What about starting oral iron supplementation? The oral iron supplementation may correct the deficiency but does not address the potential underlying cause. Okay.
Mhm.
What about testing for Helicobacter pylori? It is appropriate if you are thinking about malabsorption. But in older patients, think about the bad stuff. Think about the bad stuff first. Think about GIT malignancy first.
Mhm.
D, rechecking ferritin in 6 months is a delay in diagnosing a potentially serious condition like colorectal cancer. So, for example, if I'd given you this question on a CDM, okay, and then I said choose the best three answers or something, okay,
Mhm.
and you choose colonoscopy, but then you also went to choose D, recheck ferritin in 6 months.
Mhm.
Doctors, how much do you think the candidates will score?
0,
Why?
because
Dangerous answer.
it's a dangerous answer to delay the
They
diagnosis for
ignore
another.
the diagnosis.
Beautiful, beautiful,
Yes.
beautiful. We are getting it. Now let's go to the next question. Let's go to the next question. So it looks like we are getting a lot of answers. C. Now it looks like we've really, really, really drummed that in. Who is taking next question for us, please?
A
Next question.
30, a 30-year-old woman is diagnosed with iron deficiency anemia. She
Mhm.
recently underwent bariatric surgery. What is the most likely cause of her anemia? A, increased blood loss. B, reduced iron absorption. C, decreased dietary intake. D, gastrointestinal bleeding.
A lot of people are going for um B, reduce iron absorption, and that is true. Why is B correct? You have a 30-year-old woman who is diagnosed with iron deficiency anemia. She recently underwent bariatric surgery. So, doctors, what happens in bariatric surgery? At times, a portion of the stomach may be taken off, and that is the reason why the patient probably is having the anemia. And what is the explanation? Reduced iron absorption usually occurs after bariatric surgery, especially when there is a procedure that bypasses the duodenum, okay? Because the duodenum is the primary site of iron absorption. So that is the reason. That's the reason why patients who undergo bariatric surgery usually develop iron deficiency anemia after that. What about increased blood loss? That's not likely unless she has a history of heavy menstrual bleeding, and then decreased iron intake is not a primary cause in this particular patient. So let's move on to the next one. So always remember bariatric surgery, especially if they deal with the duodenum, because the duodenum is the primary site for iron absorption in the GI tract. So there can be a problem there. Next question. Let's go. Let's go. Next question.
I can read. A 50-year-old male presents with fatigue and history of atrophic gastritis. His lab results show iron deficiency anemia. What is the most likely mechanism of this anemia? Blood
Let me.
loss, blood loss, increased iron requirements, reduced iron absorption, chronic kidney disease.
Is it A? Is it B? Is it C? Or is it D? What is your answer? So it's very similar. Atrophic gastritis. What is happening then? So there's an issue with iron absorption. Okay, atrophic gastritis leads to decreased iron absorption. Bariatric surgery, especially if they take the duodenum away, also affects iron absorption. Okay, so reduced iron absorption is most likely the cause, as atrophic gastritis reduces gastric acid, impairing iron absorption. Okay, next question, please. Next question.
I can read that.
Yeah, please.
A 28-year-old female presents with fatigue. She reports drinking more than 1 liter of tea per day. Her ferritin level is 15 nanogram per milliliter. Which of the following is the most likely cause of her iron deficiency? Options: occult gastrointestinal bleeding, iron malabsorption, C, excessive tea consumption, D, menstrual blood loss.
Okay. So what will be our answer? And then what I'll do is, after this, I'll need somebody to put in all the learning points we've done with the cases we've dealt with, okay? And then tell me a pattern they are seeing. All the learning points with this patient who is taking a lot of tea, with this patient who is older with anemia. Like, I want you to just tell me the high yield points you are getting from this, but let's finish the questions first. So obviously this patient is taking a lot of tea. What is the answer? And the answer will be excessive tea consumption. In other words, this question is just, or these questions we are going through right now are telling us the various ways anemia can present. So we've seen that older gentleman, it could be because of malignancy. Bariatric surgery. Why? Because if the duodenum is affected, that is the primary source of iron absorption. Then we went to atrophic gastritis. That can also lead to anemia. Now we've come to excessive tea intake. So, for example, in those who are going to prepare for narcolepsy, for example, you're taking a history of a patient with anemia. These are critical things you want to hit on. How old are you? Have you had any surgery? Do you have any underlying medical condition, especially atrophic gastritis? Have you had, any bowel surgery, like bowel surgery to reduce your weight? Can you tell me a little more about your diet? Do you drink tea? If yes, how much tea do you consume a day? So you realize that all these questions we are going through are taking us through various causes of anemia and the various circumstances. So excessive tea can inhibit iron absorption. And the reason is because of what you call tannins. So tannins, okay, especially when they are consumed in large amounts. So you realize that the cause of iron anemia in a patient who has heavy menstrual bleeding is totally different from the cause of anemia in a 70-year-old who does not have any obvious source of bleeding. And at the same time, it's also different from the cause of anemia in a patient who just went through bariatric surgery. But they are all presenting with anemia. Okay. So, doctors, can someone just summarize like the learning points they've developed from the cases we just did? Then we'll go into a deep dive into iron deficiency anemia, and then we'll move on. I need somebody to help us, please.
Can I do that?
Okay.
Please do that. Yeah, let's go ahead.
So while evaluating patients for anemia, first we have to look for instance, we have patients symptomatic for anemia, or there are blood in dialysis showing. So firstly, we have to see patient's age, whether young or old. If the patient is
Mhm.
young, it could be decrease, it could be menstrual cycle, or it could be young and female, or it could be dietary, like in the excessive tea consumption. And then we have to ask further, dig down into history. We have to ask the surgical history, and then, like for instance, if patient underwent bariatric surgery for
Yeah.
excessive for overweight, then that could also be a predisposing factor. And further, we have to ask for past medical history in case patient suffered from like atrophic gastritis. That could also be a predisposing factor. In case of
Mhm.
elderly, if elderly is presenting with anemia, that could be a red flag for colorectal carcinoma, and we have to go for colonoscopy right away.
Beautiful, beautiful, beautiful. Done beautifully, right? So these are the
Thank you.
things you need to, yeah, no, that's fine. So these are the things we need to pick up so that we don't just rush through the case and then we've not really picked up a lot of things. So I really prefer that when you're going through cases like this, you take your time and you ask yourself, so I've solved this question, I've solved that question, I've solved that question. Now, what is the pattern I'm seeing? I see that there's a hand raised up. Dr. Amy Jones. Amy Jones, please ask your question.
Good
Amy
afternoon,
Jones.
Dr. Boni. I
Yeah.
have a quick question. The cause of anemia in the patient that had bariatric surgery was malabsorption.
Yeah.
So why is it that the cause of anemia in the patient that was taking too much alcohol is not the same thing, but rather the excessive tea consumption?
No, the patient who we said, except it was not alcohol, it was tea. The patient was taking
Yeah.
about 1 liter of tea a day.
Mm-hmm.
Mhm.
So the patient that had the bariatric surgery, the cause of the anemia was because the patient was in malabsorption.
Yes.
Yeah. So why is it that when we came to the patient drinking excessive
Tea.
tea,
Mhm.
we did not say it was secondary to iron malabsorption. Instead, we say it was excessive tea consumption.
Okay, so when we're talking about, thank you very much. That's a very good question. So when you're talking about malabsorption, you're talking about a GI tract pathology. This
Yeah.
time, the tea is binding the iron even before it becomes accessible for the stomach or for the duodenum and the stomach lining to absorb it.
So it
So
is not malabsorption.
yes, no, no, no. It's not malabsorption. Malabsorption is like, patients with atrophic gastritis, patients who have part of their stomach taken off, and because of that, they don't have enough surface area to absorb the iron, right? But remember that in this particular case of excessive tea consumption, the tannins are binding to the iron even before it gets to the lining of the stomach. So there's no problem with the lining of the stomach, there's no problem with the line of the duodenum. The only thing is that because the iron is bound to the tannins, it is difficult for the body to absorb it. So it is not a
Oh,
problem of the body, it's a problem
oh,
of how the
yeah,
iron
yeah,
is
yeah.
being presented to the body. Is that okay?
Okay, I get it. I
Done.
get it. Thank you.
Beautiful, beautiful, beautiful. No worries. We are all here to learn together, right? So let's take it from there.